Good morning. Hello everyone. Today's my topic is poliomyelitis. I'm Dr. Vidhi Tiwari, Index Department of Physiotherapy and Paramedical Sciences. Definition. Poliomyelitis is a highly infectious viral disease which mainly affects young children. The virus is transmitted by person to person, spread mainly through the fecal-oral route or less frequently by a common vehicle, example, contaminated water or food, and multiplies in the intestine, from where it can invade in the nervous system and cause paralysis, also known as infantile paralysis. The word polio means gray and myelitis means inflammation of the spinal cord are derived from Greek word. Poliomyelitis is a disease of the anterior horn motor neuron of the spinal cord and brain stem caused by poliovirus. Causes of poliomyelitis. First, poliomyelitis is caused by infection with a member of genus enterovirus known as poliovirus. Second, there are three serotypes of poliovirus: type 1 PV first, type 2 PV second, type 3 PV3. Third, all three are extremely virulent and produce the same disease symptoms. PV1 is the most common type and the one closely associated with paralysis. Types of polio. Spinal paralytic poliomyelitis. In this, the motor neuron in the anterior horn of spinal cord are affected. Paralysis is usually asymmetrical, predominantly involves proximal muscles with pain and tenderness. Most commonly, it affects the leg. Extent of weakness can vary from a single muscle group to complete tetraparesis. Bulbar paralytic poliomyelitis. It occurs due to damage to the medulla, bones, and midbrain with dysfunction of the cranial nerve nuclei, respiratory and vasomotor regulating centers in the medulla. It can lead to respiratory muscle failure, distress of respiratory control, dysphagia, dysphonia, and dysarthria. Bulbospinal paralytic poliomyelitis. It is also known as respiratory poliomyelitis. It has symptoms both of spinal cord and bulbar poliomyelitis. It causes paralysis of the diaphragm, dysphagia, and respiratory failure. Polio encephalitis. There is inflammation of motor neuron within the brain stem, motor cortex, and the spinal cord. It leads to stiffness of the back and neck, muscle cramps, headache, and paresthesia. Distribution of polio paralysis. Lower limb 92%, trunk plus lower limb 4%, lower limb plus upper limb 1.33%, bilateral upper limb 0.67%, trunk plus upper limb plus lower limb 2%. Polio symptoms. There are many symptoms of polio, and not everyone will experience all of the symptoms. The symptoms vary according to the type of polio. In mild polio, some of the symptoms are headache, nausea, vomiting, general discomfort, or a slight fever for up to 3 days. In non-paralytic polio, aseptic meningitis, the symptoms are similar to mild cases with the addition of moderate fever, stiff neck and back, fatigue, and muscle pain. The symptoms for polio and paralytic polio are different. Individuals with paralytic polio experience tremor, muscle weakness, fever, stiffness, constipation, muscle pain, spasm, and difficulty in swallowing. Even without symptoms, people infected with poliovirus can still spread the virus and cause infection in others. This is known as subclinical polio. Post-polio syndrome. Post-polio syndrome refers to a cluster of potentially disabling signs and symptoms that appears decades and average of 30 to 40 years after the initial polio illness. Common symptoms of post-polio syndrome are continuing muscle and joint weakness, muscle pain that gets worse, becoming easily exuded or fatigue, muscle wasting, also called muscle atrophy, trouble breathing and swallowing, sleep apnea or sleep-related breathing problems, low tolerance of cold temperature, new onset of weakness in previously uninvolved muscle. Common muscle involved in residual paralysis are tibialis anterior, tibialis posterior, quadriceps. Common deformities encountered in residual poliomyelitis is flexion, abduction contracture at hip joint, flexion contracture at knee joint, valgus deformity at foot. Pathological gait in poliomyelitis. Hand to knee gait is the sum of the quadriceps weakness and fixed knee flexion deformity. Limb shortening is another added problem. High stepping gait, limping gait, and paraplegic gait. Prevention. Individual children should be protected by immunization with polio vaccine. Two types of polio vaccines are available. First, an inactivate killed injectable polio vaccine, IPV. Second, a live attenuated weekend oral polio vaccine, OPV. Both vaccines are highly effective. Management. There is no cure for polio. Symptomatic and supportive treatment. It includes antibiotics to prevent infection and analgesics for pain. Surgical treatment include tendon transfer, arthrodesis. Treatment of polio require long-term rehabilitation. Assessment. Demographic details. Name, age, gender, chief complaint, present medical history, onset gradual, any medical, surgical or PT treatment, benefits of the treatment, past medical history, history of vaccination, oral or injectable, history of any previous disease like CB, encephalitis, CDH, CTEV, etc. On observation built, mesomorphic, endomorphic, ectomorphic, posture, spine, line, sitting, walking, attitude of the limb, alignment of the body landmark, alignment of the spine, external appliances, wheelchair, orthosis, walking gait, spleen, gait, quadriceps gait, high stepping gait, limping gait, and paraplegic gait. Examination, aerobic capacity and endurance, arousal, attention and cognition, anthropometric measurement, cranial nerve integrity, ergonomic and body mechanism. Gait, locomotion and balance, integrity, joint integrity and mobility, motor function, muscle performance, include strength, power and endurance. Neuromotor development, sensory integration, pain, posture, range of motion, reflex integrity, sensory integrity include proprioception and kinesthesia. PT treatment, acute stage, goal. First, to prevent respiratory complications. Second, to relieve pain and spasms. Third, to prevent contractures and deformity. Fourth, to maintain range of motion and strength. Fifth, to promote vital functions. Sixth, to provide relaxation. Recovery stage, goals. First, to maintain and increase range of motion and strength, to improve posture and gait, to improve sensory integration, improve balance and locomotion, to improve aerobic capacity. Residual stage. At the end of the 2 years of paralyzed muscle is expected. So finally, the role of surgery takes place. Goals. First, stabilizing of the joint. Second, to prevent contractures and deformity, to increase range of motion and strength, to improve posture and balance, to improve gait and locomotion, to improve functional activity, to improve mobility and joint integrity, to improve motor control and muscle function. PT intervention. First, chest mobilization technique, clapping, vibration, checking. Second, splinting. Third, range of motion, passive movement. Fourth, standing exercise. Fifth, stretching exercise. Sixth, balance and postural training. Seven, gait and locomotion training. Eight, cardiovascular training. 9. Pain management. 10. PNF. 11. Electrical stimulation. 12. Weight-bearing exercises. Orthotic prescription. Before prescribing orthosis, it is necessary to assess first the strength of hip abductors and hip extensors, knee extensors, hip, knee, and ankle stability, strength of upper limb length measurement and gait pattern, contractures and deformities. Thank you.